Brought to you by Penguin.
The Complete Guide to Breast Cancer.
Written and read by Professor Trisha Greenhalgh
and Dr. Liz O'Riordan. Chapter 1. Joining the Cancer Club. We've been there. The moment you find out that you have breast cancer, your life changes forever. Your first reaction is likely to be one of shock, horror, or disbelief. You may worry about what the future holds, and whether you will live long enough to see it. Most people who get breast cancer in the UK go on to live for many years, and most do not die of breast cancer. But some will get a recurrence. However long you live for, you will never return to being a non-cancer patient. For the rest of your life, you will be in one of two phases. 1. Having active treatment. This will include some or all of surgery, radiotherapy, chemotherapy, hormone therapy, and other targeted therapies. 2. Living after active treatment. This is sometimes known as survivorship. Your life will be interrupted by periodic hospital appointments, mammograms, or scans, adjusting to the side effects of breast cancer treatment, and coping with the possibility that your cancer might come back. If your cancer comes back, called secondary cancer, you enter a third phase, and this can happen even 20 years after your first diagnosis. This can, of course, be very upsetting, and we cover this in detail in Chapter 23. The first couple of weeks after diagnosis can be a period of uncertainty and confusion. You have to deal with the fact that you have got breast cancer, as well as taking in a lot of information about the treatments you need. Friends and relatives may ask you a lot of questions that you don't yet know the answers to. It can be hard to believe you have cancer because you don't feel or look ill. This is because, unless you have secondary breast cancer, the only symptom you are likely to have is a lump, and some people don't even have that. Unlike some other kinds of cancer, early breast cancer doesn't make you feel tired or short of breath or generally unwell. Why me? This is often the first question that people ask. The important thing to remember is that getting breast cancer is not your fault. The two biggest reasons why women get breast cancer are simply because they are women and are getting older. Most breast cancers happen in women over the age of 50. Your breasts are made up of glandular tissue and fatty tissue. If your breasts have more glandular tissue than fat, known as dense breasts, this can also increase your risk. All of these things are outside of your control. In a nutshell, most breast cancers are sensitive to the female hormone estrogen, and the older you are, the more estrogen you have been exposed to in your lifetime. The lifetime risk of a woman developing breast cancer is 1 in 8. While you are in your 20s, your risk of developing breast cancer is very small, 1 in 2,000 women. During your 60s, your risk is higher, 1 in 15 women. There are other lifestyle factors that have been proven to increase the risk of developing breast cancer, and these include being overweight, not exercising regularly, and drinking alcohol, more than the recommended guidance of 2 units a day, especially if you are postmenopausal. That being said, you can still get breast cancer if you are slim and exercise regularly, like we did. There are other things that have been shown to increase the risk of breast cancer, such as taking the oral contraceptive pill or hormone replacement therapy, HRT, for many years, not breastfeeding your children, or not having children at all. However, there is no way to prove that the reason you have breast cancer.
Sample complete. Ready to continue?